Then we have our D-SNP plans. So for those not aware, D-SNP means they need Medicare and Medicaid. So this is what the access card looks like. Arizona Healthcare Cost Containment System, access. This is the only time they will have to have two cards. They do need to both use their UHC card as well as their access card when they go to the doctors. Otherwise, that doctor does not know to bill the rest to access, and then they're going to get 20% bills. And you don't want that to happen. There are still, that number's still low now, but there's over 250,000 dual eligible members in the state of Arizona. Unfortunately, it does not mean we can help them all because some are in areas that we don't have the plan or can't do it. But there is a great big opportunity out there, and it is one that's not touched by a lot of people. And there's some people who build their whole business just on that. And they're some of our top selling agents. So who are some of our D-SNP consumers? So 2 out of 5 live with a disability. Not surprising. A lot of people get on access because they have a disability, and then eventually get on Medicare afterwards. 38% are under the age of 65. Not that you should ever be judging the book by its cover when you talk to people about Medicare, because you never know if they are or they have a family member who is. You never know. But especially in the D-SNP space, anywhere from, and really I've seen them as low as like 4 or 5 put under D-SNP up till they're about to die. 36% still live alone, so getting them some extra resources can help out a lot. And then nationally, the average income we see from them is about $11,000. So less than $1,000 a month. So as we look at our benefits, you can see that getting this extra dollar amounts that we give them, it's not even hyperbolic to say, it can be life-changing, flat out. So within this access system, there are 3 different categories that we have that can qualify. So we have the Access Complete Care Services. This is your normal Medicaid, where they qualify based on their income and their assets. They get help with their medical costs. There is the Arizona Long-Term Care Service, also referred to as ALTCS. This is for those that need nursing home level of care as determined by the state. It does not mean they are necessarily in a nursing home. They could be at home. They could be with family. It's a level of care that is determined by the state through a process, but they get additional benefits for home health aides, adult daycare, respite care. We have one of our plans designed specifically for these members. And then we have our Department of Developmental Disabilities, also referred to as DDD. This is important, especially if you sell in counties outside of Maricopa, Pima, Pinal, and Gila counties, because they would need to have DDD in those other rural counties to qualify. But this is things like autism, cerebral palsy, epilepsy, cognitive and intellectual disabilities. Again, this is something that they go through and apply through the state. The state goes through a process where they talk to a caseworker and or an RN who makes that determination. You can kind of see what the requirements are if you go on access the website, but essentially they need help with at least 3 activities of daily living, which if you look at, if you talk about cerebral palsy, autism, like they hit those in like no. But again, DDD serves over 40,000 people in the state of Arizona. It is an underserved area. So if you can help those out, it's always really good. This map I leave in here because the light blue for our S plan, our regular dual plan, they just need to qualify for Medicare and Medicaid. Anywhere in the dark blue, they need to have either DDD or ALTCS if it's available in that state. We don't have the ALTCS contract everywhere in the state right now. We will next. So what are some of the benefits, the highlights of the D? Well, obviously, over-the-counter healthy food utilities benefits. They get utilities tossed in there, which is fantastic. Basically no costs as long as they're going through network providers. And that includes medical costs, prescription costs. We pick up the rest of $300 for eyewear, hearing aids. They get $3,500 or more in dental, depending on their plan. Just a lot of great benefits in here. So let's just jump into the plan. So we have 2. Like I said, Arizona Complete AZ S00. I always like to say, remember, S equals standard. So this is what the vast majority of your people will end up on. So they need to be full Medicaid. That's QMB plus, SLMB plus, FBD. If they're in the rural counties, they would need to have D. But with this, you'll see I don't put any co-payments on here because you got to be fully qualified. Access picks up the rest. So don't need to talk about it. $3,500 in debt, $3,600 allowance for hearing aids. Again, $165 in reward. But the big benefit is $189 a month for healthy food, over-the-counters, and utilities. Utilities includes water, sewer, internet. It does not include phone, unfortunately. But the other question I always get is, well, what if it's not? What if the bill's not? As long as the bill is for the address that we have on file, they can still use it for that location. We understand a lot of people live with family. The family may be the one who has the bill. So as long as that matches up, they're good. If it doesn't, then they got a lot of money to use for healthy food. So really great